Hi, my name is Melissa Pickerel and I'm a student at Maryville University. Today I'll be performing a head-to-toe assessment on my patient Brandon. Prior to having Brandon enter the examination room, I requested that he empty his bladder and change into comfortable clothing. I've obtained his height, weight, and vital signs. I've tested his distance vision using the Snellen chart and his near vision using the Rosenbaum chart. Cranial nerve 2 is intact. I have washed my hands and will begin my exam. I'll begin by looking at Brandon's head and face. Brandon's head is upright and still with no abnormal movements present. Looking around his head, it's nice and round and symmetrical, normocephalic. I see no visible masses or depressions. Looking at his hair, it's nice and smooth and brown in color, no signs of alopecia. Brandon's skin is clean, dry, and intact. His facial bones are nice and smooth and symmetrical, no skeletal deformities present. His eyes are symmetrical on his head, and his ears are symmetrical on his head. Now I'm going to move on to palpation. I'm going to palpate Brandon's skull first, and it's nice and smooth and symmetrical with no masses or depressions present. Feeling that scalp while I was feeling the skull, it's mobile, non-tender, free of nits or scaling. Brandon's hair is nice and smooth and symmetrical, and the hair follicles are nice and strong. Moving on to palpation of Brandon's face, I'm palpating for any deformities, any bumps, any tenderness, and I feel none. Now I will palpate Brandon's frontal sinuses, no tenderness present, and Brandon's maxillary sinuses, no tenderness present. Now I'll be palpating Brandon's temporomandibular joint, so I'll place my hands on that joint at his jaw and ask him to move it up and down and side to side. So you move your jaw up and down and side to side. There's no popping, clicking, or pain present when he does that. Next, I'll be testing some cranial nerves associated with the head and face. So first, we'll test cranial nerve 7. I'll have Brandon perform some facial expressions with me, and I'm looking for symmetry. So if you would wrinkle your forehead, close your eyes tight, clench your teeth, puff out your cheeks, smile, and stick out your tongue. So all those facial movements were symmetrical, so cranial nerve 7 is intact. Next, we'll move on to cranial nerve 5, or the trigeminal nerve. I'll test both sensory and motor function for this. So Brandon, first I'm going to have you close your eyes, and I'm going to touch you with a cotton swab on your face. I'm going to ask that you tell me when you feel my touch.
No, 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 no.
So sensory function is intact. Now I'm going to have Brandon move his jaw up and down and side to side as I palpate his strength and musculature. That's all nice and symmetrical and strong, so cranial nerve 5 is intact. Now I'm moving on to Brandon's eyes. Brandon's eyes are nice and symmetrical on his face. His eyebrows are present on both sides. They're nice and symmetrical. Hair is equally distributed. They extend away from the outer canthus. Extend toward the outer canthus. I see eyelashes on both eyes. They extend away from the globe as they should. The eyelids are free of any redness, flakiness, tenderness, or tremor. They cover the top part of the iris bilaterally as they should, and when Brandon closes his eyes, they cover the eyes completely. The iris is nice and brown on both sides. The pupils are equal and round on both sides. The periorbital and orbital area is free of edema and redness. And now I'm going to just take a peek inside Brandon's eyes. I'm going to look at the sclera and the conjunctiva. So I'm looking at the sclera, it's nice and white, and his conjunctiva is nice and pink. Now I will palpate Brandon's eyelids if you close your eyes for me. I feel no nodules, no tenderness present. Now I'm palpating the lacrimal gland. It's non-tender, not really palpable, and it should not be. So next, we'll do some tests of Brandon's vision. First, we'll test Brandon's peripheral vision. I'll ask him to tell me when he first sees my fingers.
No. No. No.
So Brandon's peripheral vision is grossly intact. Next, I'm going to look at Brandon's pupillary responses to light. So I'm going to check direct and consensual response. So direct and consensual, and direct and consensual. So his pupils are nice, equal, and round, reactive to light. Next, I'll be looking at Brandon's extraocular eye movements. This tests cranial nerves 3, 4, and 6. So I'm going to have Brandon watch my finger, follow my finger with his eyes without moving his head. Finally, convergence. We have nice symmetrical convergence there with no extra eye movements. When I tested Brandon's peripheral vision, I was using the confrontation test. Now, to repeat, cranial nerves 3, 4, and 6 are intact, as all those extraocular eye movements were nice and symmetrical and looked good. Next, I will test using the cover-uncover test. This is looking for any extra eye movement. So Brandon, I'm going to have you look at me and just cover your left eye with both eyes open and then uncover it. So cover your left eye, uncover it, and your right eye, uncover it. There's no extra movements present, so that's normal. So moving right along, I'm moving on to Brandon's ears. I'm looking at them. They are nice and symmetrically placed on Brandon's head. They're appropriate for race, clean, dry, and intact. I see no drainage present. I see no deformities or nodules present. Next, I'll be palpating. So I'm palpating the auricle. It's nice and firm and mobile and non-tender. The pinna is equal with the inner canthus on both sides, as it should be. Next, I will be looking inside of Brandon's ears with my otoscope. I would usually do this on both sides, but to save time, I'm just going to look in one side. So I'm going to pull the pinna up and back so I can visualize the canal and the tympanic membrane. There is slight cerumen present, no redness. The tympanic membrane is a nice pearly gray. It's intact and the light reflex is present. So next I'll be testing cranial nerve 8, or the acoustic nerve, by testing Brandon's hearing. So first we'll do the whisper test. Brandon, I'm going to have you close your left ear, cover it. I'll stand back to your right side. I'm going to whisper a word and ask that you repeat what I say. Baseball.
Baseball.
So Brandon's hearing is grossly intact. Next, I'll perform the Weber test. This is testing for any unilateral hearing loss. Do you hear it in one ear or both ears?
Both.
Equally?
Yes.
Great. So that's normal. And next, I'll be performing the Rhine test. This is testing for any sensory neural or conductive hearing loss. So I'm going to place the vibrating tuning fork on Brandon's mastoid bone. He will tell me when he no longer hears it. I will move it in front of his ears, and he will tell me if he can continue to hear it. Again, this is usually performed on both sides, but to save time, I'll just perform it on one.
Good. Good.
So air conduction is twice as long as bone conduction, as it should be. So again, cranial nerve 8 is intact. So now we're moving right along. I'll be moving on to Brandon's nose. It's nice and midline and symmetrical. The skin is clean, dry, and intact. I see no deformities or masses present. I'm going to ask that you occlude your right nostril and take a breath, and your left nostril and take a breath. So Brandon's nasal patency is intact. I'm going to look up into Brandon's nostril here, and the mucosa is a nice glistening pink. The turbinates are the same color as the surrounding tissue, no swelling present. The septum is nice and midline and intact. So Brandon's nose all looks normal. Cranial nerve 1 would be tested using different scents if Brandon was having any problems smelling, but since he's not having any problems, cranial nerve 1 will not be tested here. Now I'm moving on to Brandon's mouth. I'm going to look at mouth and throat. I'm going to look at the outside first. So I'm looking at Brandon's lips. They're nice and moist and smooth with no cracks or lesions present. Brandon, I'm going to use my tongue blade and look inside of your mouth. Can get a good look here. You're looking in with the light here. Okay, so I'm looking at Brandon's buccal mucosa. It's a nice light pink color. It's smooth, it's glistening. I see no sores or lesions present. The gums show a tight margin at the teeth. And I see 32 white ivory teeth that are in good repair. I'm looking at Brandon's tongue. It's a duller red color, nice and midline, no tremors. It's slightly rough. Brandon, if you would lift up your tongue, yep. So it's smoother and a lighter pink on the bottom. The frenulum is present. You can put your tongue down now. I see no sores or lesions on the floor, sides, or tongue in the mouth, so I don't suspect any oral cancer. Brandon, I'm going to have you tilt your head back just a little further as I look back further. So I'm looking at the soft palate, it's intact. The hard palate, it's intact. The soft palate is continuous with the hard palate. I see the uvula is midline. I see the anterior and posterior pillars are intact and nice pink color, no redness or swelling. I see no enlarged tonsils. So all of that looks good. And now I will be testing cranial nerves 10 and 9. So cranial nerve 10 is the vagus nerve. So I'm going to elicit the gag reflex, and I'm looking for symmetry of your soft palate and your uvula to be midline. Also, I smelled no mouth odor as I was in there with looking at Brandon's mouth and throat. And then when Brandon gags, he will simultaneously swallow after, and that tests cranial nerve number 9. So Brandon, I'm going to elicit the gag reflex. So the soft palate rises symmetrically, the uvula remains midline, so cranial nerves 10 and 9 are intact. Now I'll be moving on to cranial nerve 12, so I'm just going to look at your tongue. So if you'd stick your tongue out, it's nice and midline, there's no tremors present. If you move it up toward your nose, down towards your chin, and side to side, cranial nerve 12 is intact. Now Brandon, I'm going to ask that you please remove your tank top as I'm going to start moving down. So I'm looking at Brandon's neck next. His neck is nice and symmetrical, the muscular symmetrical. The skin is clean, dry, and intact. I see no visible masses or lesions present, no visible jugular venous distension or carotid artery prominence. I'm going to look at some of your neck movements to see how your neck is moving. If you would tilt your head towards your chin and back, and your ear to your right, ear to your left, and turn to the right, and turn to the left. So Brandon's neck movements are nice and smooth and painless. Now I'm going to do a couple with resistance. So if you would turn to your left, and your right, and front, and back, and shrug your shoulders for me. So that was all smooth and painless, and he had good strength in his head and his shoulders. With that shoulder shrug there, cranial nerve 11 was tested and is intact. Now I'm going to palpate. First I'll palpate Brandon's carotid arteries one at a time. Nice, strong, and regular. Nice, strong, and regular. Now I'm looking at Brandon's trachea with my thumbs at the side. It's nice and midline. There's no tracheal tug present. Next, I will feel Brandon's thyroid for any tenderness or nodules. So Brandon, I'm going to place my fingers at the side here and ask that you swallow. And swallow one more time for me. And I feel no nodules. It's nice and smooth. Next, I will be palpating some of your lymph nodes. So I'm going to, if you just keep looking forward, I'm going to palpate Brandon's occipital, preauricular, postauricular, tonsillar, submandibular, submental, superficial cervical, posterior cervical. If you would turn to your right for me, deep cervical, In your left for me, deep cervical and supraclavicular and infraclavicular and axillary and axillary. I feel no enlarged lymph nodes or any tenderness present. Finally, I'll be palpating, auscultating Brandon's neck with my bell. I'm going to have you hold your breath as I auscultate or listen with my stethoscope your carotid arteries and then your thyroid. Hold your breath for me. And you can breathe. I'm just going to listen over your thyroid. So no bruits were heard there. Moving on to Brandon's upper extremities. They're nice, symmetrical, equal in muscle mass, length, size, and hair distribution. They're nice, warm, dry, and intact. I see no edema present. I'm looking at Brandon's nails. They're nice and clean and pink. I see no signs of any clubbing. Capillary refill is less than 3 seconds, so that all looks good. Now I will palpate Brandon's pulses on his upper extremities as I'm here. So first his radial pulses, nice, strong, and equal, and then his brachial pulses, nice, strong, and equal. So Brandon, I'm going to have you turn around now so we can take a look at your back. So looking at Brandon's back, it's nice and symmetrical. The skin is clean, dry, and intact. I see no visible skeletal deformities. The thoracic and lumbar area are concave. The thoracic area is convex. The anterior posterior diameter is less than the lateral diameter. Next, I will be palpating Brandon's back. So first I'll just palpate for any tenderness or skeletal deformities. I'll run my fingers down Brandon's spine and the musculature at the side. Now specifically, I'm going to palpate for any costovertebral tenderness. And there's no costovertebral tenderness present. Now I'll be palpating for Brandon's thoracic expansion. I'm looking for symmetry. I'm placing my hands right, my thumbs right at the spine here, and going to have Brandon take a deep breath in and can release that. So nice symmetrical hand movement with his inhalation and exhalation, and my hands were placed around T10 there. Next, I'm going to palpate for tactile firmitus. So Brandon, if you would just say 99 as I place my hands on your back.
99, 99, 99, 99.
So those are nice and equal with the tactile firmitus there. Next, I will be percussing. So first I'll percuss all of Brandon's posterior and lateral lung fields. If you'd lift your left arm up for me. And your right arm up for me. So nice resonant percussion sounds there. Next, I will be percussing for diaphragmatic excursion. So Brandon, if you would lean forward for me, kind of curl in. Take a deep breath for me and hold it in, please. Great, and you can let that out. Going from an area of resonance to dullness. Now, Brandon, if you would take a deep breath and then exhale and hold it for me. Okay. So diaphragmatic excursion should be anywhere from 3 to 5 centimeters. And measuring Brandon's, it's right about 4, so that's within normal limits. Next, I will be auscultating Brandon's back. Before I do that, just talking about how his breathing, it's nice and symmetrical and even and unlabored, and the rate is within defined limits. So yep, you can sit up and take a couple deep breaths for me as I listen. And lift your left arm up and deep breath. Good. And your right arm up. So nice vesicular clear breath sounds were noted. So Brandon, you can turn around to the front again. I'm going to inspect Brandon's anterior chest. First, I'm going to focus on respiratory, and then I'll look at the cardiac portion of the anterior chest. So looking at Brandon's chest, it's nice and symmetrical. Breathing is symmetrical on inhalation and exhalation. I see no signs of labored breathing or retractions. The rate looks to be within defined limits. So I'm going to just feel across again. No deformities or tenderness present. I'm going to palpate for tactile firmitus, so you can say 99.
99. 99. 99.
So that is nice and equal. Now I'll be listening for breath sounds. So some deep breaths for me. So nice vesicular breath sounds were noted there. So Brandon, I'm going to be laid back for me. I'm looking at Brandon's anterior chest for cardiac function. And so looking at his chest, it's nice and symmetrical. I don't see any pulsations or heaves present. I'm going to palpate Brandon's chest. The skin is clean, dry, and intact. The chest is non-tender, no deformities present. Next, I'll palpate the precordium. So I'm going to start at the apex, the left sternal border, and the base. And I feel no lifts, heaves, or thrills present. And finally, the point of maximal impulse. And no lifts, heaves, or thrills present there. Brandon, I'm going to have you sit up again. And just lean forward a little bit. I'm going to listen to Brandon's heart sounds. So I'm going to start by listening to, usually I would listen with both the diaphragm and the bell, but to save time, I will just listen with the diaphragm. So I'm listening to Brandon's aortic area, pulmonic, Erb's point, tricuspid, and mitral. S1, S2 are normal. There's no murmurs present. So moving right along, I'm going to have you lay back down, Brandon. I'm going to look at your abdomen. So as Brandon lays down, his musculature is nice and strong there. He has muscle prominence, which is normal in our thin patients. Looking at Brandon's abdomen, it's nice and symmetrical and flat. The skin is nice and uniform in color. I see no visible peristalsis or pulsations present, no masses, no distension present. So everything looks good there. The umbilicus is midline and inverted. Next, I will be listening to Brandon's bowel sounds in all four quadrants. And they're all present, and now I will listen to Brandon's arteries with the bell of my stethoscope. So aortic and renal and iliac and femoral. No bruise heard there. Next, I'm going to percuss all 4 quadrants. Nice tympanic sounds. Now I will percuss for the liver span, moving from tympani to dulnus. Right there. And down. Midclavicularly down. Right about there. It should be anywhere from 6 to 12 centimeters. And Brandon's is about 8 centimeters. So that's nice and normal there. Next, I will palpate Brandon's spleen. So Brandon, if you turn to your left just a little bit, left. And a little hard to find, but it's right there on the left side there. Splenic dullness is present. Next, I will be palpating. So I'll begin with light palpation just to get the patient comfortable. And then deep palpation. I feel no masses, there's no tenderness, no guarding. I'm going to palpate for the liver. So if you would take a deep breath and breathe out. And I feel the liver as it's displaced downward. And I'm going to percuss for the spleen. If you take a deep breath, you can feel the tip of the spleen there, but it's not enlarged, so not that easy to find. Next, I'm going to palpate for the kidney. So if you take a deep breath. Okay, I captured the right kidney. And again, take a deep breath for me. And the left one. That's all normal. Now I'm going to palpate for Brandon's aortic pulsation. It's right to the right of midline. And it's present. Okay, Brandon, you can sit up. Now I'm looking at Brandon's lower extremities. They're nice and equal in length, size, muscle mass, and hair distribution. They're nice and warm and dry and intact. There's no signs of any edema. His nails are nice and firm and pink. There's no clubbing present. Cap refill is less than 3 seconds. Brandon, I'm going to have you move to the chair quickly. And I'm going to feel Brandon's pulses. So I'll just do this on one side to save some time. So his popliteal, good, strong, equal. And his dorsalis pedis down here. And his posterior tibial. Nice and strong and equal. Next, I will be testing Brandon's reflexes. So first, I'll do his brachial radial. So just relax your arm. And you got slight movement of the thumb there on the brachial radial. Now I'll be testing the patellar and the foot kicks there, and then the Achilles. Nice movement of the foot as would be expected. Finally, I'm going to finish up with Brandon's neuro exam. I'm going to have you close your eyes and tell me where I touch you on your body or when you feel my touch. So close your eyes. Just say when.
Arm, hand, knee, foot.
And that is all intact there. And then finally, we're going to do some back range of motion. So first, I'll test your strength if you can lean forward against my hand and back against my hand. And if you would stand up for me, lean forward and back, tilt side to side, and turn, and turn. So all of those are smooth and painless. We tested some other muscle strengths and range of motion movements throughout the video. We'll just do this for now in order to save time. And this completes my head-to-toe video. Thank you.